very clinician focused, so it's highly customizable, adjust to change over time. It made us more efficient just having, one solution. Well, to start, when we were in the selection process, we were trying to get rid of 3 software platforms and combine them into one. And so Persivia was able to do that for us. So we were trying to combine a registry, quality reporting, and our ADT feed. And so that made us more efficient just having, one solution. Next, in terms of our workforce, we had our clinical staff was going into a variety of systems and EMRs to gather clinical information. And so the Persivia platform is able to display all of that information in one location in tabs that are easy to navigate. So that made us more efficient immediately. So we went from gathering information for 7 out of the 8 hours to actually taking care of patients during that entire time. In terms of clinical outcomes, we have our own quality scorecard that we had previously developed, and so Persivia was able to recreate that in that platform. And then through those customized reports, we have nearly doubled our physician score on our scorecard. And then we also use the platform to report HEDIS supplemental data to our payers and to our state HIE. And so we're seeing improvement in both our commercial and our ACO performance year over year. So the CareTrack module is installed right in the EMR. It follows along with the patient that the provider is working on. So it's right there built in their workflow. It has a single sign-on, so they don't need to sign in anywhere else but their EMR. And then it's fully integrated right within the record. And so as they're in the visit with the patient, CareTrack will display the HEDIS gaps in care on the CareView card. They're also able to look at their physician scorecards that we've developed for them. So it helps to keep those providers fully engaged with what's going on versus having to stop what they're doing and go to another system to sign in. A lot of customization, especially on our quality dashboard. So we already had a look and feel that we wanted from our prior vendor, and Persivia was able to incorporate that. So we have, as a physician signs in to their quality dashboard, they have a customized graph of how they're performing. We have our customized scorecards, both a quality metric scorecard and then what we call a clinical integration scorecard, which has a variety of measures on there. And then we've also customized our transition tab to add in some additional information columns that we wanted to look at, both utilization, risk stratification. We've also modified social determinants of health screenings based on some of the payer requirements we have here in Michigan. So we've done a lot of customization to the tool, and it's been fairly seamless in terms of the product. So we do view this as a true partnership between McLaren and Persivia. We've had a really long relationship dating back to work that was performed with our Port Huron Hospital before they were even acquired by McLaren. Next, we had a need to report data out of 2 EMRs for the CMS CPC Plus program. And then our work, since we've been working together with our population health tool. So we've really been able to grow our programs at scale. We're a statewide organization with managing hundreds of thousands of patients. And so the tool has been able to scale with us and how fast we want to go. We've been able to get really good provider engagement with the tools. They like using the tools. We have independent providers integrated with the tools, and they are asking for different things. So I feel that that's really good to have provider engagement. That's important to our success, is to make sure they're using the tools as they've been designed, including the HCC coding support tool. So we're seeing incremental improvement in our performance there. We've used the Persivia platform as well for our quality reporting tools for our ACO using the web interface, and we're preparing for the ECQM. So the team at Persivia is very knowledgeable about those requirements to able to help us learn, that new process. And then in terms of our care coordination, we've been able to launch chronic care management and principal care management, which includes all the support for our billing and coding. That has never been able to be done at McLaren. And so we've been very proud of that work and the ability to achieve that new revenue source. So a lot of positive successes in our work together. So we have both payer driven programs in Michigan. Our payers have a lot of requirements, so we're able to, I'll say, label the programs and then be able to track the outcomes. How many patients are engaged in each of these programs, using the appointment scheduling to make sure that the right staff are assigned the next task, time tracking. So able to use that for our care coordination, chronic care management programs and other programs. So there's just a great deal of flexibility. Either it's a program that Persivia already has or something that will be built for us. We're able to utilize that and make sure that patients are attributed to that right program, and then we can track the outcomes by program. We also have the hierarchy set up to the way that McLaren does business, which is by our regions, by our practices. And so we can pull a lot of different data in that way as well to compare regional performance. I think
Do you
they
have
find
any
it.
insight?
Yeah, I
I'm
think
sorry.
they find it extremely easy, whether, it's one of our navigators or nurses or our physicians, to get to the information that they need. Um, in fact, during a recent downtime that we had that was extended, we were able to still access Persivia, provide care. Physicians were able to access pertinent clinical information. So it has the information that they need, and it's very easy to locate. You can do an export if you're looking for some larger database information, but extremely easy to use. And, the amount of training really is not significant. They're able to just begin using it and locate the information they need. I think the first thing that I noticed was how intuitive it is to use by the clinicians, whether it's my care coordination team or our physicians. It takes very little training in terms of the session, and they're able to get right in there and perform their work. It's very clinician focused, so it's highly customizable in terms of assessment tools, care pathways that really work with our processes. And I think it adjusts to change over time. So as we've added in new programs, whether it's external payers that are asking us to do something or things that we've developed, it's been very flexible on the platform to be able to create those workflows or any forms or things that we need to do our work.